Medical debt was the focus of two bills heard by the House Health and Human Services Committee today. State House reporter Grant Green has more on why the sponsor believes it is important to address this kind of debt.
As one opponent acknowledged, most Americans can relate to spontaneous medical debt, which is why Representative Brian Mulder looks to make that debt less of a burden.
Mulder's first item, House Bill 1058, prohibited reporting medical debt to a consumer reporting agency that produces credit scores.
The situation I think about is when you have somebody who needs a car, for example. The issue is if they have that much lower credit score, they're paying, a much higher interest rate.
Opponents expressed concern that this bill would only hurt those who rely on the utmost accurate credit reporting.
Medical debt, when left unreported, can create an incomplete picture of an individual's financial standing, impacting lending decisions and creating unintended consequences for the broader economy. Lenders, landlords, and even employers rely on credit histories to assess risk and repayment ability.
Mulder's second bill, House Bill 1210, would have prohibited hospitals from reporting medical debt to debt collectors.
And these unwarranted collections actions are causing stress, they're causing harm, and South Dakota law right now has nothing in place to protect patients who are living through these experiences.
But opponents rebuked this claim, saying the hospitals put in the effort to help relieve medical debt.
Hospitals in this state last year gave out $134 million of charity care, $134 million of charity care, and $73 million of care that was not covered by Medicaid reimbursement costs.
House Bill 1058 was passed on a 9-4 vote. However, House Bill 1210 failed and was moved to the 41st day on a 10-3 vote. In Pierre, Grant Green, Dakota News Now.